And again, ladies and gentlemen, it is my honor to welcome Professor Dato Dr. Adeeba Kamarulzaman, the Chief Executive Officer and President of Monash University, Malaysia, to deliver her keynote title, Transforming Health System, Technology as the Key to Sustainability and Resilience. Ladies and gentlemen, please welcome Professor Dato Dr. Adeeba Kamarulzaman.
Assalamualaikum and good afternoon, everyone. Thank you very much to the organizers for inviting me this afternoon. I'm fully aware that you all have had a fantastic lunch at PWTC, and I will try to run through this, what I'd like to think is a very important topic that touches us all, no matter which discipline you're in, which industry you're in, and that's how we can take advantage, leverage this digital revolution to improve the healthcare system and health of the nation. So I think never a day goes by without us reading in the newspaper that the Malaysian health system is in crises. And not only you hear the concerns of the rakyat, the healthcare workers, but also in recent months, the concerns of the government and Bank Negara, the insurance industry, of the rising healthcare costs and medical inflation, and that Bank Negara had to step in and put a cap on the increase in medical insurance because it just skyrocketed and became very, very unaffordable for most people. So this is what we're facing with at the moment. And it's not just, well, there are many reasons why medical inflation has gone through the roof. Partly because we are living longer because of advances in medical technology, in how we manage patients, but also because, and so, you know, we have an increasing aging population, but also because we're faced with one of the region's highest prevalence of non-communicable diseases, of hypertension, of obesity, of diabetes, that then leads to early morbidity. So even though we're living longer, because you know, the state of our healthcare, we are able to keep people alive longer, but 20% of the population, although we're living longer, 20% will reach there with significant illnesses, including end-stage renal failure, including strokes, including cardiac disease, etc. So that is also adding to the burden to the health system. And then, of course, we're faced with ongoing challenges of climate change, flash floodings, heat, and its connection, to infectious diseases, which, you know, if like me, you follow the trends in infectious diseases and future pandemics, most experts will say that it's not a matter of what, but it's a matter of when, again, we'll get another significant epidemic. So all these things, I think, put together makes a compelling case for the need for transformation of our healthcare system. And certainly the advances in technology, I think, gives us a huge opportunity to improve the health system and to get to a health system that we want, and ultimately to a healthier society, healthy individuals like this beautiful couple that I found on the internet here. But I think it's also very important to understand that yes, the answer to a better and healthier health system and healthy nation partly lies in technology, but as you all very well know, probably that technology is not the be-all and end-all to this. So let me go through some examples of how technology has transformed things. The first is, of course, telemedicine. Would you believe that Malaysia had a Telemedicine Act in 1997? But it took the pandemic for us to really, really embrace the use of telemedicine. And on my right are some of the, where the private sector has embraced telemedicine, whether it's this Doc to You, Doc on Call, or Doctor to You, or some of the private hospitals have also established their own telemedicine. But the Ministry of Health, working with Ministry of Communications, have also partnered in NADIS, the Ministry of Telecommunications drop-in centers, to provide basic sort of health information and healthcare. So there are movements in terms of rolling out telemedicine, but I must share with you a frustration in terms of telling you that we've thought about telemedicine for a long while, but during COVID, I chaired the hospital task force, PPUM. That time I was still at and chaired the PPUM task force on COVID, and wanted to pivot very quickly to telemedicine, because we virtually changed the entire 1,200-bed hospital to a COVID hospital. But the current act says that the very first consultation for telemedicine has to be a face-to-face. And so no matter how much I scream, no matter how much I told people to we're in a crisis, just do that first consultation online, as is what telemedicine is for. The answer is no. We have to go by the books, we have to go by the law. And so, there we were, stuck, unable to, until, months and months into the pandemic, when people realized that, yeah, this is a real emergency, real crisis, that eventually we were allowed to see patients online, rather than compelling them to come and sign a consent, as is what's written in the law currently. And happy to note that I think these laws are being revised soon. So this just summarizes, which again, this is about electronic medical records, which I think forms, in a way, the basis for healthcare transformation. And we're very fortunate in having a health minister currently who is absolutely committed to this, who has seen and who believes in all the benefits, whether it's at the patient or provider level on my right, or at the systems level. And in terms of if nothing else, to reduce duplication. How many of you have been to 2 different hospitals, have had 2 same sets of bloods within weeks or within days, because those records are not transferable? And of course, the fancier EMR will also allow us doctors to help with inbuilt clinical decision support mechanisms, improves engagement and adherence, and at the systems level, integration with telemedicine and AI, and hopefully cost savings through reduced errors. And importantly, what insurance companies and many other companies are looking at is that huge database for population health, and eventually for data mining, for AI and other purposes. So many, many benefits to rolling out the electronic medical records. And alhamdulillah, as I said, the Ministry of Health is very committed to this, and after a lot of stops and starts, with Selayang being the first paperless hospital many years ago, I think we're now really seeing MOH turbocharging the implementation of EMRs into hospitals, into clinic kesehatans all around the country. So this is their plan, and they've already established EMRs in 385 health clinics around the country, including 7 rural health clinics just this year alone. The hospitals a bit slower because it's a bit more complex, but as you can see on the left side of the screen, what the plans are by the end of 2028. So really kudos to MOH now for beginning this transformation, which, as I said, is the start of a healthcare system that's hopefully going to be more efficient and more cost effective. Okay, so telemedicine, electronic medical records, and of course apps for everything, I think, is what people think of when you think of digitization of the healthcare system. This is a program that I've been very fortunate to be involved with as chair. It's called the Rose Foundation, which is a brainchild of my colleague at UMMC, Professor Wu Yin Ling, who's a gynae oncologist, and she had this idea using systems thinking of how can we use the latest in screening for cervical cancer using self-sampling. If in the past us women had to go through the indignity and pain of doing pap smears, this self-sampling, very much like a COVID test, allows women to just go to the toilet, sample themselves, and have the results almost immediately. Well, the swabs have to be sent and analyzed by a PCR somewhere. But what Yinling designed or worked with colleagues in Melbourne was it's not just about the sampling, but also about this digital health platform where the person registers, results then get sent to them through a call center or an SMS, and the most important thing is that they are linked to care, because there's no point in testing if you're not linked to care. So this whole ecosystem is very, very important. And Program Rose was established about 4 or 5 years ago, at a time when pap smear studies show that only about 30% of women will have pap smears in their lifetime. And the recommendation is, of course, to have pap smears every 2 years. So the success of Rose that we're all very proud of is in just a short time, we've been able to reach more than 1.7 million people in terms of education, etc. 37,000 women have been screened, and like I said, the most important thing is the 88% linkage to care and follow-up. So if there are any abnormalities, they are advised to go to the nearest clinic or the nearest hospital where they can undergo colposcopy and be followed up. So we're now working together with MOH through their clinics as well as their hospitals to expand Program Rose using that very important but simple digital technology. Similarly, at the Malaysian AIDS Council and the Malaysian AIDS Foundation, we have a similar setup, but this one, it's it's a very important platform to have because of the stigmatization of what we call key populations, whether it's men who have sex with men, or transgenders, or sex workers, or people who use drugs. They can order the tests online. It's called Test Now. This website is at Ministry of Health and AIDS Foundation and AIDS Council website. They provided online counseling and then navigated to where they can pick up the test kits. Then they share the test kits again online confidentially, and if the test comes back positive, then we would once again refer them to the nearest clinic for either treatment, or if part of that risk assessment considers them at significant risk, we would also channel them to prevention and pre-exposure prophylaxis. So there is a live dashboard up to when this test now has only been around for about 2.5 years, I think. There have been close to 14 or just over 14,000 tests that have been ordered. Slightly more than half have been amongst either gay or bisexual men. And you can see that the rate of positivity is higher amongst those who use this test as opposed to face-to-face. And what is really important is you can see there is 43% of those who utilize this service never tested before. So in an era when we believe we can truly end AIDS by reaching to 90% of people who need to know their HIV status, and of those 90% should be tested, and if positive, given treatment, and if given treatment, should reach what's known as undetectable viral levels, so they not only do well for themselves in terms of their health, but do not pass on the virus to others. Once again, this digital technology is a very, very important mechanism to reach people who otherwise won't come forward to see doctors or healthcare providers because of fear of stigma and discrimination. So another good example of relatively simple technology, but could, for both cervical cancer and HIV, there is a global aim to eliminate both two diseases, and a simple, relatively simple technology that encourages people to be tested, given their results, and linked to care is using technology is very important. Now, this is a brand new, so moving along into a more sophisticated example of how technologies, particularly AI, is going to change the health, the health field. This is an article in Nature from where the lead author is, I think, a PhD student from Monash, Australia, and looking at using AI in a very, very detailed way to assist dermatologists to analyze. Australia has a very high rate of skin cancer, especially melanoma, which is a potentially fatal skin cancer, and using close-up photos, pathology slides, and total body photographs that was fed into this AI model. What they managed to show is there was an improvement in skin cancer diagnosis by 11% when used by doctors. So it can be notoriously difficult to tell a melanoma skin lesion, as opposed to, particularly in older population, as opposed to just other forms of skin tags. So this invention called PanDerm made Nature Medicine publish just a couple of months ago. So, in addition to the use of technology for better patient care, for better diagnosis, better linkage to care, better education, I think one way in which technology can really improve our healthcare system is in operational efficiency. And here, if you ask me, it's probably, in terms of prioritization, this is probably where we should put our money in, improving how we schedule medical staff, nursing, doctors. At the moment, I believe it's all still on Excel sheets or pieces of paper, in terms of payment, billing, practice optimization, and healthcare compliance. And of course, with AI, how it can then be used to improve patient flow, appointments, and so forth. So personally, I think this is where Ministry of Health should put their resources in once the EMRs have been deployed. Okay. In this one slide, I think it, from the New England, again from just a few weeks ago, it very, very nicely summarizes how AI is going to revolutionize global health, from the benefits such as decision support systems and diagnoses, patient care, as I've alluded to before, drug discoveries, medical education, something I haven't touched on, which again, utilizing, it doesn't even have to be AI, using online and communities of practice, which in a way is already happening, but not in a structured way. We can reach out to continue training and medical education for colleagues who are deployed in Sabah, in Sarawak, and other rural parts of Malaysia. And also using technology to improve patient literacy, one of the Achilles heels of the Malaysian public, where we know that survey after survey shows that our rate of health literacy is around 11 or not more than 20%. So deploying technology wisely can really improve that, in my estimation. The challenges are, of course, many. I touched on the patient privacy and PDPA issues. I'll talk a little bit about biased results, cultural sensitivities, but there are solutions to all of this. Of course, number one would be investment, financial investment. It's really, really important to, if we want to design any of these technology solutions, that we involve the end users. The early electronic medical records, the early electronic medical records often failed because they were designed by computer engineers, not involving the end users, and it was clunky. It was, doctors and others who use it hated it. But now I think we all understand that any digital technology should be co-designed with the end users, so that it makes sense and it's accepted. Okay, so again, every day you hear the moans and groans about Malaysian healthcare system. Every day you hear about yet another AI diagnostic tool that's going to do wonders, and we doctors are going to be out of a job. Thankfully, I'm nearing my end of clinical years, but I think, as Oscar Wilde said, the death of the medical profession is probably greatly overrated. And one of the reasons is, and this was a report in last week's Financial Times of a summary of several publications that came out in the last few weeks cautioning the use of AI in clinical diagnoses because the LLMs reflected bias that can lead to inferior healthcare advice, especially in relation to females, Black and Asian patients. This was a study from UCL, a similar study from the US also came to the conclusion. So it's imperative, I think, that we here in Malaysia, in low and middle income countries, be part of this and start to build these big databases that can then contribute to this, because these biases are real and can have real consequences. So that's one of the challenges of digital technology. The second is, now I'm very proud, and thanks to Mosti Meranti, this is my colleague from Monash University, Malaysia, who's been dedicated to developing an AI support tool for people with cardiac failure, and doing it on, as we say, on the back of an envelope to try and get this invention out there. Any tools that involve patients obviously need clinical trials, which can be costly, but she's just received some good news in the last couple of days in terms of local support looking at it. So the point of those two slides was to share with you that it can be a real struggle to design this technology here in Malaysia and to get it to market. So, but thanks to Mosti and others, hopefully we'll see an improvement in terms of that whole pipeline of research, pre-commercialization, clinical trials, and out into deployment. One last thing in terms of the challenges that we face in executing digital and AI transformation. This is a survey of a global survey done by McKinsey, looking at what are the challenges. The ones in black are ranked number 1, the lighter blue number 2, and 3 is ranked 3rd. And up there, most people say it's the legacy systems that are difficult to upgrade and integrate. The next is, of course, budget limitations. 3rd is workforce that's not ready to implement new tools, poor data quality, business and clinical digital collaboration. And so these are some of the things that I think in our zest to adopt digital technology that we have to look into and overcome. So finally, what can health systems do, and how can they learn from other industries? It's very clear that my profession, the health profession, is very conservative, and it took a pandemic to wake us up to the benefits of really embracing digital technology. As I said, we had telemedicine since 1997, but we're using it very sparingly. When you look around, when you look at the banking industry, when you look at the airline industry, when was the last time you walked into a bank? You can do everything from looking up flight schedules to checking in online in 10 minutes. Those things are still far away for the health professionals. So I think the health profession has a lot to learn from these other industries. It's imperative that we build partnerships, particularly with tech companies, because these digital tools and toys are expensive. We need to find ways in which it's a win-win. We need to move beyond off-the-shelf solutions, and there are many talented colleagues in the country who've done just that, to deploy technology based on their know-how and their own experience working, even colleagues of mine. And again, I'm very critical of my own industry, but I think for a reason. In order to really embrace the potential of digital transformation, I think it's very, very important, and perhaps not just in the health fraternity, but all of us need to think differently. I think when we first used to use EMR, it was basically deploying what was written on paper onto a computer screen, but it should really be more than that. We need to operate differently, whether it's the structure of the organization, the types of talent we need, the ways of working, and only then that I think we will be able to truly benefit from this revolution in digital technology that's before us. And I leave with these last two slides a plea. We must not allow technology to worsen the inequities, the digital divide between the elderly, the poor, the rural. It's very, very important to have governance and regulation, and then, of course, in addition to investing in machines, we need to invest in people. So these are some of the ways in which I think moving forward, Malaysia can hope to really embrace digital technology to help the present desire to transform health in the country. Thank you very much.
Thank you, Professor Dato Dr. Adeeba, for that powerful and insightful keynote. Of course, ladies and gentlemen, we would like to take a question. Hopefully, Professor Dato Dr. Adeeba can answer like maximum up to 2 questions. So we have the first one. This question, it says here, is there any initiative championing more inclusion of medical data from Asia in order to combat training bias by primarily Western-based data and developers for AI medical tools? So, Professor Dato Dr. Adeeba?
Yeah, I don't think there is, as far as I know, correct me if I'm wrong, I don't think there is a conscious effort to do this, but there are many kind of databases that, for example, insurance company databases would be a good place to start. We've approached one of the insurance companies to work with them to look at the medical inflation issue that I was talking to you about. But within that, they have millions and millions of data points that would feed into these sorts of things. There is, as part of the WHO Science Council, we are hoping to, for example, get countries in this region to work together on a genomics project. There are, again, many genomics groups in the region, but it's in my mind, it's not as cohesive as the ones that, there are a couple of huge genomics consortium in Africa. So in Asia, I think we need to bring these disparate genomics groups together in order to perhaps have what you're asking here.
All right, thank you again to Professor Dato Dr. We'll take one more question. Let's have a look. All right, so our last question is, how could public-private partnership potentially fund our health system expenses, particularly those related to upgrading current infrastructure to enable technology adoption and transformation?
Yeah, so I think bricks and mortar is very difficult to convince private companies to expand that. But certainly in the area of technology adoption, I think some of the examples I showed you, the ROSE project, for example, we are funded by Etika, which is the insurance company which is part of Maybank, that has has given us from the beginning significant amount to help us implement and scale up the ROSE program. So that's one example, and I think, and of course, the AIDS Foundation one is funded by the Global Fund, but not from private partnerships. But in the end, with private companies, there are two streams. One is how can these digital technologies that we deploy help them with their bottom line, right? For their shareholders to improve their stock or whatever. And the other is the CSR arm of it. The CSR arm is usually a little bit more limited, but it's in working with them to see, to look at a win-win solution, I think would be my answer to that.
All right, thank you, Professor Dato Dr. Adeeba, for that insightful presentation. Before we proceed to the next session, ladies and gentlemen, we would like to invite Professor Dato Dr. Adeeba for a very quick photo session on stage. All right, thank you again, Professor Dato Dr. Adeeba. And again, ladies and gentlemen, please let's give Professor Dato Dr. a huge round of applause one more time.